Before watching our videos, please subscribe to our channel and then tap the bell button so that you can receive our new videos notification fast.
The worst lies you can tell your doctor. 1. I feel fine. The first of the worst lies you can tell your doctor is that you feel fine when you don't. This phrase is very common among those who struggle with depression and don't recognize that they need help. Some of these patients feel sad and think that this problem can't be solved by a specialist. 2. I follow a healthy diet. The second of the worst lies you can tell your doctor relates to your eating habits. People generally say that they eat less and better than they actually do. That's why nutritionists recommend keeping a food diary. However, when a patient tells this lie, they also often alter their food record. They do this also to avoid being scolded by the specialist. 3. I'm taking my prescribed medication as always. This lie can make it difficult to control chronic diseases such as hypertension, diabetes and asthma. It's very difficult to take medication forever. However, your doctor may have the idea for you to stop taking it gradually. We know that it's sometimes annoying to remember to take that pill. In other cases, it may simply be impossible for you to afford prescription drugs and you would rather lie. 4. I only have sex with my partner. No, telling your doctor that you've been unfaithful is very frequent and happens because the patient fears that their specialist will judge them. Remember that your doctor is a person you can trust completely. They're there to help you, not to harm you. Don't forget that everything you say is under doctor-patient confidentiality. However, there's an exception to the rule when a person has a sexually transmitted disease and the doctor knows that the patient has had unprotected sex with another person who has not been informed. In this case, the specialist has the obligation to inform that person whose health is at serious risk, because threats to life always outweigh professional secrecy. However, don't forget that being responsible with your and your partner's health is vital. 5. I don't drink, or I don't smoke. Many people say they drink 2 or 3 glasses a day or smoke only 1 cigarette, when in fact they consume more of these substances. In situations where you may be excessively consuming alcohol or cigarettes, your relatives can help the doctor to determine whether you have an addiction. Before you get angry or deny the situation, analyze what the reality is. Excessive consumption of alcohol provokes physical, psychological, social and moral repercussions. Tobacco, on the other hand, can cause various types of cancer. In both cases, lying about your consumption of these substances can also make it difficult to control chronic diseases and their treatments. If you're diabetic, your glucose levels will be constantly changing. In addition, some medications lose effectiveness or cause negative reactions when combined with other substances. Don't lie to your doctor. Keeping secrets, omitting symptoms and information about your lifestyle can interfere with medical diagnoses. It's essential that you tell the truth about your habits and lifestyle. It'll be normal for you to feel out of your element and embarrassed when having certain conversations. For instance, you may be afraid of being criticized and judged, but your doctor is there to help you. You certainly don't want to suffer any allergic reaction or major medical problems just because you lied.